My first experience with the breath hold device was one where my expectations were low because all I'd seen is a brief video on the device. And I'm not someone who's very good at reading instructions or watching videos. And I had a very complicated patient, the one that most doctors dread. It was a patient who had an extensive smoking history, who had underlying what they call chronic obstructive pulmonary disease or emphysema. She had a 5-millimeter nodule, and it was in the center of the lung. So I put the breath hold device on the patient, and we went through how to calibrate respirations. And we literally performed the biopsy with a single pass core biopsy, an 18-gauge core biopsy of a 5-millimeter nodule in a patient with extensive COPD with no bleeding, no pneumothorax, and a diagnostic biopsy. We had a patient, her oncologist called and asked me if we could potentially do this biopsy. So I said, we can try. I said, but it is a very difficult biopsy, and she will 100% get a pneumothorax. And I talked to her on the phone. I said they have developed this new device at the Mayo Clinic, a breath hold device, which is designed to decrease your complication rate and increase the diagnostic yields by making it so that you don't breathe as much during the procedure, or your respirations are more calibrated during the procedure. So she came into the hospital with all these expectations. We strapped it on her, and that woman followed the directions perfectly. She held her breath perfectly when we asked her to hold her breath. And I have never used a device and not gotten my diagnosis.